Hello, everybody. My name is Joerg Raab. I'm an associate professor of policy and organizational studies at Tilburg University. And in the following short clip, I would like to report some of the findings from our study on the governance responses of infectious disease outbreaks, in which I have been involved in the last 5 years, together with colleagues from Tilburg University and from the National Institute for Public Health and the Environment here in the Netherlands. So these colleagues are Patrick Kenis from the Tilburg School of Economics, Marleen Kraai, now Institute for Physische Vaardigheid, and Aura Thiemen, the country coordinator for infectious disease control at the National Institute of Public Health in the Netherlands. So if we look at the national safety profile from 2016, we can see that there are actually 4 potentially health hazards that were looked at out of 30. And number 2, a very serious flu pandemic with a lot of impact. So an outbreak like the coronavirus was on the radar or has been on the radar for some time. Actually, the coronavirus outbreak was just a new outbreak in a series of outbreaks in the last 2 decades, like SARS in 2003, Zika, Ebola, and relatively serious flu pandemics. So these outbreaks, not only virus but also resistant bacteria, have become more likely. And there are no medical treatment options. So the only option that we have, at least in the beginning of an outbreak, is to respond with a very well coordinated response. So organizational capacity becomes very important. So the exclusive focus on the virus bacteria is not sufficient, but we also have to pay attention to the complex governance systems that evolve to control the outbreak. In a highly interconnected world with a lot of autonomous but interdependent powerful actors within and also outside the public health system, it is therefore impossible, at least in a country like the Netherlands, for national authorities to control the response top-down. Rather, we have to assume that it will be more of a network response that is actually required. The National Institute of Public Health here in the Netherlands, RVM in Dutch, therefore needs to understand what kind of field develops and what kind of actors will become active in case of an outbreak, but also which kind of actors might not get activated, which nonetheless might have crucial information, especially in the early stages of an outbreak. So what we did here in this study since 2015, we looked at 2 fictitious scenarios. One, new Asian coronavirus, which is characterized by human-to-human transmission, and West Nile fever, which is characterized by transmission through mosquitoes as 2 comparative cases. The rationale behind that is that different pathogens and different ways of transmission will likely lead to an activation of different actor sets and therefore also potentially different network structures. Think, for example, that if the transmission goes through mosquitoes, you also have to have actors involved in combating mosquitoes. So if we look at actual outbreaks and also here the new Asian coronavirus, so the scenario we looked at, respondents got a scenario of a potential outbreak, and we identified here 43 different actors that would be involved in such an outbreak response. And we can already see here that the numbers vary quite a bit, but that usually there are quite several dozens of actors involved, which lead to complex networks. These are control measures that we identified that have to be taken in order to contain the outbreak. In case of the new Asian coronavirus, there were 28, and here the numbers signal the number of actors, organizations that are involved in this control activity. And for example, right now, in the actual corona outbreak, we discuss the isolation and the monitoring of contacts, track and tracing, the isolation, and we can see here that there are almost a dozen organizations involved in the Netherlands in these activities. So that needs a lot of coordination. If we put this in a network structure here, the blue dots are the organizations and the circles the control measures. Then we can see that complex structures evolve, no clear clusters, which signals that there are actually a lot of coordination is necessary to somehow come to good results. In terms of the information, so this is an information structure based on what respondents told us they would forward information to and would receive information from. We can see here that both in the new Asian coronavirus case and the West Nile virus case, that's a very complex communication structure with the National Coordination Authority, so in the Netherlands, RVM, on top. And these are outgoing ties, so information sent. These visualizations are the two depictions of information received, and also here the National Coordination Authority comes up on top. Also here quite complex information structures. So if we conclude, we can see that different pathogens create different fields with different actor sets, and they are not necessarily stable. For example, right now, there's new evidence that the coronavirus can be transmitted from humans to, for example, minks, and mink farms here in Brabant, and also back to humans, which means, for example, now the Ministry of Agriculture gets involved and organizations that deal with animal health. We see that there are large and highly differentiated networks with the lead organization form around the National Coordination Authority. We have a lot of different control measures that need to be done in order to control an outbreak. There's no clear clustering in this scenario. And we can also see that in the actual coronavirus outbreak, that sometimes it took some days to get things going. And for example, now the track and tracing that should go in as of June 1st took some time to actually get the municipal health service going because there's coordination necessary. We saw that there are 10 or 11 organizations actually involved in that potentially. Ideally, we can conclude that the National Coordination Authority, so the RVM, should be positioned in such a way in the network that it has first the perceived authority and the mandate to coordinate the actors, that they have sufficient time and resources to pool the available information as impartially as possible, and third, and that is the contribution of this study, to also recognize, monitor, and assess the evolving organizational network. So it's not only the epidemiological response, but also the governance response that requires attention in order to safeguard the necessary coordination. If you want to know more, you can access the paper it's freely available. If you type in the title in Google Scholar, you will get to the repository of Tilburg University. Thanks a lot for listening.